Maryland Spotlight. It's all about Maryland living.
Welcome back to Maryland Spotlight. We're talking about lung cancer, and so we brought on a couple of doctors who are in that expertise. Dr. David Nayamjan, you are a pulmonologist, and Dr. Mohit Naurang, an oncologist. Thank you both for being here today. Doctor, let's talk about statistics, because a lot of people think that lung cancer is a smoker's disease, but it's not always the case.
About in this country, 250,000 people are diagnosed with lung cancer, of which 165,000 do die of this cancer itself. That comes to be 1 in 14 people are at risk to develop a lung cancer. It's seen both in males and females, and it's the #1 cancer both in males and females.
Well, you were talking about risk factors. Doctor, do you want to address that?
Certainly, the most common risk factor that we know of is exposure to tobacco smoke, but the other risks would include exposure to carcinogens that might be found in the industrial environment, as well as radiation.
Now, screening is always very important in this kind of a situation. Talk about screening and its importance.
Screening in lung cancer is currently recommended for people who are at high risk, who are smokers for a long time. We recommend a CT scan once a year, which has shown to decrease the mortality.
So if you do have these risk factors, it's just so important to get screened and screened early.
So, right.
Well, let's talk about longevity now. How did you become involved in this?
Michael Osborne, a lung cancer survivor who was a patient of mine, who was actually taken care of by Dr. Clement Knight, a colleague of ours who passed away last August. This walk is in his honor and memory.
That's terrific. And really, the importance of this walk and getting people out there is for awareness, for risk factors, for screening. Did you want to add to that?
Right. When Michael first approached us about becoming involved with longevity, we were excited because we saw it as an opportunity to advance lung cancer awareness in the community. Typically, cancer has a stigma that it's due to tobacco and it's something that's self-inflicted. But we're also advancing the education on lung health awareness. And that's why we're excited about the longevity program.
Well, I'm glad that you became involved. And again, we want to invite everybody out to Breathe Deep Columbia 5K that is going to be going on in Columbia. Certainly well worthwhile to benefit the lung disease awareness, certainly getting out about the risk factors and the screening, so it's very important. Thank you both for joining me today.
Thank you.
All right. And thank you for joining us today on Maryland Spotlight.